Welcome back. There seems to be no end in sight for fraud and corruption in the country. A health worker at the Parkhurst Clinic in Johannesburg has taken it too far, selling fake COVID-19 negative test certificates to travelers. The 28-year-old suspect was arrested over the weekend and appeared in the Boyson's Magistrates Court today. Let's now bring in Mvuyisi Mzukwa, who's the Vice Chair of the South African Medical Association. Thank you so much for making time, Mvuyisi. Just give us some more details about this nurse who was selling these fake negative COVID-19 results. What information do you have?
Well, we have information, like the general public, that there's been an unfortunate incident where a healthcare worker in Gauteng was found to be, on the wrong side of the law, selling fake COVID-19 tests and giving to travelers so that they can be declared as negative. And that's a disappointment that we found ourselves in today and the days before.
Yeah, and obviously this person is not working alone, right? More people may be involved to pull this off. This requires a number of players.
Yeah, that's very true. I think the law enforcement agencies may as well just dig deeper, than what meets the eye. Because if you look at this, if a healthcare worker can have access to such a sophisticated lab information and technology, then it means there's actually many people involved in this. So I think they really need to dig deeper, because this has huge implications, not only for the people that get the test, but also for the country itself.
Yeah, and maybe you can expand more on those implications, right? What are the consequences of this? Because I'm thinking, people's lives are compromised here. In fact, even just generally, the national plan to deal with this pandemic is compromised.
Very true. I mean, if you give a negative test to somebody who might be positive, the implications are that you might allow that person to, spread the virus even to the most vulnerable in the communities. But also, what you are going to do with this is going to compromise our good standing with other countries, because if people look at our results, they'll start having doubts as to the legitimacy of those results. So it's very important that we really work on this, and the law enforcement agencies will need to set an example on this one so that it does not repeat itself.
Yeah. What's your message to your members who may be tempted to exploit their positions and get involved in such criminality?
Well, our message is clear. You are against the law if you are found to be selling these unscrupulous certificates and working, with the criminal syndicates. As a healthcare professional, there are many implications. We have a regulatory body, and I think we should be working, law enforcement agencies should be working with the regulatory bodies of the country, whether it's the Nursing Council or the HPCSA or whatever regulatory body, to make sure that this person is brought to book, not only just for civil litigation, but also the professional bodies must work hard, to make sure that they care on this one.
All right. Thank you for making time, Dr. Mvuyisi Mzukwa, the Vice Chair of the South African Medical Association.